The Lucy Corr Dental Clinic is housed in the Lucy Corr Skilled Nursing Facility Complex, which is part of the Lucy Corr Continuing Care Retirement Community located in Chesterfield, Virginia. It serves as a preceptor site for the rotation of dental and dental hygiene students from the VCU School of Dentistry. The dental clinic is accessed by going through the sliding glass door without an awning that enters the Chesterfield County Employee Clinic that is also attached to the facility. The Lucy Corr Dental Clinic is sponsored by the Lucy Corr Foundation, which is a 501c3 organization. The bulk of the dental care and dental treatment provided is done so by volunteer dentists, hygienists, and assistants, along with a few staff members. Oral health is such an important part of overall health. The purpose of the Lucy Corr Dental Clinic is to improve the oral health of facility residents and community members by providing dental care free of charge to uninsured members of the geriatric population. The goal is to make older adults with no type of dental insurance infection-free in their mouth and able to function properly masticatorily, meaning help them chew. Eligibility requirements are that adults must be age 65 and over and have no type of dental insurance. Services provided in the dental clinic include routine exams, screenings, prophies, or better known as cleanings, fluoride treatments, basic restorations or fillings, extractions that are basic or simple, new dentures and partials, denture and partial repairs and cleanings, and x-rays. Sometimes on-site visits are conducted at Dominion Place. However, most dental care is provided by scheduling an appointment at the clinic. Appointments can be scheduled by informing Greg Ford or Sydney Cunningham of your dental care request, or by contacting the dental clinic directly at 804-425-7512. If you are in need of transportation assistance, you need to inform Greg and or Sydney of this need, and they will work to coordinate your transportation to the Lucy Corr Dental Clinic. When preparing for your scheduled visit at the Lucy Corr Dental Clinic, you need to be sure you are aware of your updated medical history. This can be done by working with the healthcare providers on site at Dominion Place or by consulting with your primary care physician. An updated medical history, which includes the updated medications you may be taking, is important to assist in avoiding emergencies in the dental clinic. There are medications that can cause gingival hyperplasia or overgrowth of the gums. Some examples of these meds are shared on this slide. Osteoporosis, a decrease in bone density, is much more prevalent in women, and often they are prescribed medications called bisphosphonates to address the issue. Dental care providers need to be informed if you are taking any of these types of medications, as dental treatment rendered while on these medications can lead to poor healing of the jawbone or what is called osteonecrosis of the jaw. The Lucy Corr Dental Clinic has a medical history form you will need to complete upon arrival before your initial visit at the clinic. Medical histories are updated at every visit. Medical screening needs to be done prior to coming to the dental clinic, especially for those with conditions such as diabetes, high blood pressure, certain heart conditions, joint replacements, or those who take certain medications for particular health conditions. For diabetics, it's important to share that they have this condition to oral health care providers because it impacts the healing ability of the gums after dental treatment. Improving oral health also helps with improving blood glucose levels. Poorly controlled blood glucose leads in turn to a rise in glucose levels of the saliva, which feeds the bacteria and increases the formation of dental plaque in your mouth. Evidence shows that severe periodontal disease or gum disease can increase blood glucose levels both in people with diabetes and in those without the condition. The goal is for diabetic patients to have their diabetes under control with an HbA1c reading of 7 or below. Maintaining good oral health can help with reaching and maintaining this goal. A patient's blood pressure is checked at every dental visit. However, if you are currently being treated for high blood pressure, Be sure to take your medications prior to your dental appointment. When at the dental clinic, if your blood pressure is outside the protocol established by the dental clinic, with the top number your systolic reading over 160 and the bottom number, the diastolic reading, over 100, then you will not be treated that day, and it will be recommended you have a medical consult to address the high readings. This picture shares the new blood pressure guidelines developed by the American College of Cardiology and the American Heart Association, indicating that readings of 140 and higher or 90 and higher indicate high blood pressure readings, indicating high blood pressure. The Lucy Corr Dental Clinic wants to assure the safety of all patients while being treated in the dental clinic, as it is so important to prevent medical emergencies in order to safely provide dental treatment. Many folks take blood thinners, anticoagulants, or antiplatelet medications. If you are taking any of these types of medications, you need to be sure to share this with your dental care providers. Some dental procedures provided in the office, in the clinic, cause bleeding of the gums, and if you are taking one of these medications and the clotting mechanism is not under control, the bleeding caused by the dental treatment may not stop. Because of this, it is important that folks who are taking certain blood thinners, such as warfarin or Coumadin, tell the dental care providers and have an INR performed no more than 48 hours prior to dental treatment to be sure you are properly clotting to prevent uncontrolled bleeding in the dental clinic. Bacteria from the mouth may circulate throughout the body when the dental treatment that causes bleeding is provided. This bacteria can become trapped in the heart or in the joints that have been replaced. Because of this, be sure to share any type of heart condition you may have or had with the dental care providers, as well as if you have any joint replacements, as you may need to take antibiotic pre-medication prior to your dental treatment in order to prevent bacterial endocarditis of the heart or infection in areas where joints were replaced. Guidelines for antibiotic pre-medications are often updated. This slide shares what conditions need to have antibiotic pre-medication taken prior to dental treatment to prevent bacterial endocarditis. This slide shares what heart conditions no longer require antibiotic pre-medication before dental treatment. It is always best to consult with your cardiologist or primary care physician to be sure if you do or do not need antibiotic pre-medication. The same goes for antibiotic pre-medication needed for those with joint replacements. These guidelines have been reduced and the recommendations of the antibiotic pre-medications have changed slightly. However, again, it is best to confirm with your orthopedic doctor or primary care provider in terms of needing antibiotic pre-medication prior to dental treatment. Now, with some of the logistics explained, ask either Greg or Sydney to coordinate scheduling an appointment for you or call the Lucy Corr Dental Clinic and get scheduled. We have dental chairs waiting for you. And the staff and volunteers of the Lucy Corr Dental Clinic would love to have you come in and assist with improving and maintaining your oral health, as that is a main goal of the Lucy Corr Foundation. Remember, oral health is an important part of overall health.